2024 Town Hall. Today, we're going to be going over the results of our recent COSI survey. As a reminder, this was a survey that we took between February 5th and February 25th earlier this year. Very much like we did last year when we took the survey and we had a town hall to go over the details of that survey. Our goal is to be fully transparent, to go over the good, the bad, and the ugly. And so a little bit of housekeeping items. I'm going to try to keep this under 10 minutes. And then at the end of it, we're going to be posting where we're going to have in-person town halls, where those will be about an hour, where we'll go over the presentation in more detail, and we'll also have a robust Q&A session so that we can go through things. So a little bit of update on our executive leadership team. All of us have been here this past year, myself, the CEO. We have Maria Calloway, our CNO, Bruce Miller, our CFO, Elaine Sorensen is our Senior Quality Officer. We have Brandy Ross as our Senior Director of Operations. We also have as part of our team an open COO position and an open CMO position. So more to come to fill those two positions. I wanted to reintroduce our core values. This is going to be a common theme that you see for the rest of the year where we talk about these core values. This was something that was rolled out last year, but as all you know, last year was kind of hectic, a lot of different things going on. And so we wanted to make sure that we reintroduced this and focused on it because this is something that we believe deeply in. And we want all of you to really understand this and live this as part of our team. And so first one is champion patient care, do the right thing, embrace individuality, act with kindness, and make a difference together. So looking specifically at our COSI survey. So why do we take the COSI survey? Our COSI survey is a way for us to get an annual assessment of how our culture is doing. It's a way for us to gauge, are we headed in the right direction? Are we headed in the wrong direction? What do we need to do to turn it around if we are headed in the wrong direction? And this is all part of the National Quality Program, which is how we as an organization are trying to become a high reliability organization. And this is all in partnership with Duke, who manages and oversees our quality program here at Wilson Medical Center. So looking at our survey, how did we do? We had a response rate of 82%, so 585 people out of 710. For our size organization, this is really good. Our goal is that 60 to 65%. So hitting 82% allows us to show that the data that we're going to be looking at is statistically significant. It is down from last year where we hit 96% response rate. Last year, we kind of feel that people had a lot more to say though. And so with 82%, we're happy with that measure. And with it, we believe that the data that we're going to go over is statistically significant. So there's 35 questions that we went over. All 35 increased from last year. So to me, that's a very good sign, is all 35 areas of the survey improved from when we took it last year till now. So you'll kind of find that theme when we look through the data. It appears as if we're moving in the right direction as an organization. And this is a graph showing from when we first took the survey back in 2014, how we took it in 2016, 2018. You can kind of see that decline. We made some changes 2020. We're starting to head in the right direction. Unfortunately, that's when COVID hit, and you saw that steady decline from 2020 to 2022 to our lowest point at 2023, where we scored 54%. And if you remember, we all sat down as a team and we said, is this the direction we want to be going? And we all agreed that no, we want to be moving in the right direction. We want to have a higher and better culture here at Wilson. And so we came up with some plans that we went over this past year, and we're able to get our new score, which is 79. So some really impressive things around this score is, one, it is the highest that we've had at Wilson Medical Center. We're right at that high performance goal of 80%. But more importantly, to me, also one thing about it is we had the highest increase in all 65 LifePoint hospitals. From going from 54 to 79 is a 25-point increase, which is the highest in the whole company. So I'm just very proud of the work that all of you have done this past year to really help us reshape our culture and get it headed in the right direction. But to me, this signals that, yes, we had a difficult year the past couple of years, but we've churned that ship. We're headed in the right direction. And I'm very excited to talk about some of the exciting things we're going to do to not only meet the standard next year, but to exceed it. I want to be not only the best improvement in Life Point, I want to be the best overall score in Life Point, because I'm competitive, but also it signals that we as an organization are moving forward in that journey to be a high reliability organization so that our patients can have the best care that they possibly can. And so we fundamentally believe that if we have a good culture, happy culture where you guys enjoy coming to work, where you're happy to be here, you will then take that and take care of our patients and make it the best care for them. And so me and my admin team, our focus is to take care of you. And we know and trust that if we take care of you, you will then take care of our patients. So that's why we have such a high focus on this COSI survey, because we want to make sure that you guys feel supported, you feel taken care of, and you feel that you have the resources you need to be successful in your roles. So looking at engagement, kind of looking at the different score there, that 69 score, we improved, head in the right direction. And so one thing to look here is that we scored a 69. The average for Life Point was 71. So we're right there on the company average, which last year we were definitely towards the bottom of the scores. We're right in that middle ground. And again, it allows us to start that trajectory to move to the top. Some of the focus areas that we want to be looking at, these are our top strengths. And so last year, our top strengths were feedback, compliance, and empowerment. And then this year, our top strengths are action taking, empowerment, and continuous improvement. And all those areas, empowerment was one of our top things last year. And this year, it's still a top thing, but we improved from 67 to 71 on the scoring matrix. And so even though it continues to be a strength of ours, it's even stronger this year than it was last year. And so we want to make sure we continue to keep action taking, empowerment, and continuous improvement as our strengths, because we feel that change culture that we're creating, where we're able to move in the right direction, we're able to empower people, we're able to continuously improve action taking. That's why we're seeing such drastic improvements on this score. And so that was the good. And now here's the bad. Here's the top opportunities or areas that we want to focus on. And so last year, our top areas of opportunity were safety referral, resources, and safety habits. And so we really didn't want to have one of our biggest areas of opportunity, as I would recommend this organization to family and friends as a safe place to receive care. That really just broke Maria and my heart last year, that's how we felt as an organization. And so we did a lot around trying to improve the culture, trying to improve our patient care. And so this year, that is not one of our weaknesses. So we're very proud of that. And so some of our areas of opportunity for us to work on, and even though we saw improvement from last year in all these areas, we still have a ways to go. And that's in values, resources, and collaboration. And so with this, we notice that resources continue to be one of our areas of opportunity. And so we'll focus on that, on how do we make that one of our strengths going forward? How do we get you guys the resources you need to be successful? And part of our in-person Q&A will be a conversation around, what do you mean by resources? Is this people? Is this supplies? Is this support? It's really trying to figure out what are the resources you need, because it could be a lot of different things when we say resources. So looking at the comments, we're not going to spend a lot of time on this. We just want you to know that out of the 755 surveys, or there were 755 comments for us to go through that. Me and my team have been digesting through and trying to make our way through each and every comment so that we can see what you guys are feeling. Some of the keywords and how do we make this a better place? You can see that the red is more negative connotation, gray is neutral, and blue is positive. And so better place, some of the common things we saw were facility, sickness, medical, accountable, patient care. And so this is just another way to look at the data for us to try to digest it and know where to focus our attention to. On the love the most, we saw make a difference, opportunity, work together, management, communication, home. So really, this is just a way to really look at that detail and digest it a little bit. So how do we do in each of the different job classes? And so you can look at registered nurses, non-physical, non-physician medical. You can look at management and supervision. And so red is we have opportunity, blue is a strength. But one thing, even though you see some of these reds in these areas, if you look, our scores improved year over year. So even with our nurses, there's a lot more red than I'd like to see, but each area improved from 1 point all the way up to 10 points from last year. So even though we're not where we want to be, we're headed in the right direction. So this is an exciting thing for me. I'm glad we're headed in the right direction, but it also gives Maria and I another push to say, okay, we're not where we want to be. Let's move it to the next level. And that's what we're hoping to achieve this next year is, okay, we're moving in the right direction. How do we pick up that momentum and have even better improvement next year? And so comparing us to our other Eastern Division hospitals, so the hospitals in our region, you can see our score is actually higher than the other hospitals in our region. And you can look at our improvement year over year compared to their improvement where they stayed pretty neutral. We improved drastically, and we have those blues and a lot less reds than the Eastern Division and all has. So great work, everyone. We're definitely moving in the right direction there. So next steps is we're doing this debrief with you guys from a hospital perspective. You can expect to have a debrief of your own specific department results. You as a team will identify one area to focus on. You'll create an action plan around that, and then you'll work towards that action plan. So next year, your department can be even better than it was this year. We as administration will track those action plans as part of our patient safety clinical quality meeting, which meets monthly, and we'll hold the leaders accountable to make sure that the goals that you decided to work on as a team, we can support and help make sure that you guys are successful with that. And so that's a quick debrief of our COSI survey. We'll go in more details in our in-person Q&A and town halls, but I just want to again reiterate our focus on our core values. And I want to talk a little bit around do the right thing. And so I wanted to go over our employee misconduct policy reviews and just highlight that we have zero tolerance for sexual assault, harassment, or abuse of any kind. We expect everyone in this organization to do the right thing, and we need to work together to make sure that occurs. And so some policies for you guys to look at that really highlights that journey we're on is around workplace relationships, anti-harassment policy, and violence in the workplace. And so with this being Sexual Assault Awareness Month, we just want to reiterate that we have zero tolerance for any sexual assault, harassment, or abuse of any kind. And we want to make sure that we're championing patient care, and so we have a safe work environment for our team and our patients. Some important reminders. We'll be reviewing these policies over the next coming months. If you do have a concern and want to remain anonymous, we have this ethics compliance hotline that's managed by a third-party company. The number you can call is 877-508-LIFE. And also, we always have our wonderful, amazing Danielle Vick, who stepped into our role as a director of people services or human resources. Her extension is 8033. She's always available if you have questions or concerns that you need help with. And so to wrap up, what we're going to do is we're going to send this out to you guys to review. Please look through it, come up with any questions you might have. We'll have our in-person employee town hall Friday, May 3rd from 2 to 3 o'clock, Monday, May 6th from 10 to 11, Tuesday, May 7th from 7:30 to 8:30 a.m. This will be in the auditorium. Also, exciting, some drum roll for this one. Our COSI survey, we bought that very large TV that's in human resources. I think it's a 65-inch. For anyone who attends our in-person town hall, I will give you a raffle ticket. And at the end of our town hall event, we will raffle off that large TV for you guys, just as a way to encourage you to come out in person, talk to us, give us your feedback, because that town hall is where we're going to be creating that action plan on how do we move to the next level to where we want to be. So exciting, come out, get your name in that raffle, and hopefully you'll be the one that wins that TV. So excited. I'll see you guys next Friday or Friday, May 3rd at 2 to 3 p.m. So thank you.